the views and opinions expressed by the host do not necessarily state or reflect those of the hospital and its management. Furthermore, the views and opinions of the guests do not reflect those of the host, the show, the management, and the hospital. Lastly, no copyright infringement intended. All materials used and music background credit to the owner for public service purposes only.
Maayong gabi. Ang Vicente Soto Memorial Medical Center Sub-National Laboratory itala na sa mga musunod. Karong adlong Miyerkules, 24 sa Hunyo 2020, 274 ka samples ang na-test sukad karong adlaw o kinitanan gikan sa Central Visayas. Sa kinatibuk-an, 25,678 na ka samples ang na-test sukad sa pagsugod sa atong Sub-National Laboratory. Sa 274, 122 niini ang positive ug 152 ang negative. So matotal, adun lang kitay 4,904 ka samples ug 20,724 ka negative samples. 499 ka samples akan samtangang gadagan karon sa atong Sub-National Laboratory. Pahinumdum sa tanan na mga resulta base lang sa samples nga kitest. Ang Department of Health Regional Centers for Health Development ang mupagawas og detalyadong impormasyon mahitungod sa mga positibo o mga negatibong kaso. Daghang salamat.
Aniya na mga pinakaulahing balita kabahin sa COVID-19 dinhi sa atong tambalanan karong adlaw Miyerkules, petsa 24 sa Hunyo 2020. Ang Soto mirehistro na sa mga musunod. Sa kinatibuk-an, 461 na ang kumpirmadong kaso diri sa atong tambalanan. 87 niini ang naka-recover na. 134 na ang nakutloan o kinabuhi nga naggikan sa laing-laing lugar. O sa kasamtangan, aduna pay usa ka gatos ang padayong giatiman diri sa atong tambalanan. Ug 134 usab ang na-transfer sa atong mga isolation centers. Sa atong bed utilization karon, we have a total regular bed capacity of 550 beds. Ang atong daily census kay 419 patients, which gives us a utilization rate of 77.18%. Ang atong expanded COVID-19 bed capacity kay 150 beds. Karon na atay 100 patients sa atong daily census. This gives us a utilization rate of 66.67%. Sa ICU bed capacity sa Soto na akitay 55 beds. And we have 24 patients sa atong daily census karon, which gives us a utilization rate of 43.64%. And for dedicated COVID-19 ICU bed capacity, naakitay 24 beds. And sa kakaron, naatay 13 patients according to our daily census, which gives us a utilization rate of 54.17%. Right now, naatay extended nga IEC Bayanihan, which is also an extension of BSMMC. Daghang salamat.
Alright. Maayong gabi mga quarantine. Good evening, Dr. Helen.
Hello.
Wow, another day, no? Wednesday, hump day. Pinakapaborito na kong adlaw kay tunga-tunga sa simana.
We're halfway through. Parang
halfway through.
Lang yan, now it's either half empty or half full.
Right.
So, if you have to choose between a negative and a positive, it's always good to think positive thoughts. Think happy thoughts.
Think happy thoughts,
Focus
okay?
on the happy things.
Now, karong adlaw kahibaw kay ta sa gibati sa mga tao sa palibot, no? Sa ato ang mga ka-quarantine, sa ato mga taga-syudad sa Sugbo, bisag dili taga-syudad sa Sugbo nga medyo na ay mga daghang question sa mind, ay daghang question pangutana sa utok regarding sa unsay nahitabo sa atong syudad karong adlaw. So usa na gabi, no, we have heard the news that the quarantine passes are already suspended, no? Suspended na siya. Ug ato pong nadungog ang ato ang mayor sa syudad sa Sugbo, si Mayor Labella, nga nag-explain po that these passes are out, but please stay calm and remain to be understanding, no? Okay. Naunsa man imong mga na-observe, Doc Helen, sa mga balita diha?
So actually, this is not the time to panic, no? Kagahapon, naghisgot ta og panic disorder, panic attack. This is not the time to panic. We really have to stay calm. We have to forge our own personal plans. Kini ang atong kinahanglan buluhaton sa kakaron. Hand hygiene and disinfection of all surfaces for possible contamination of COVID-19.
Correct. So kana nindot kay no nga mga explanation gikan sa ato ang Dr. Helen Madamba. So karon mga ka-quarantine we amo mong giawhag nga dili siguro nato makatabang. If yes sa imuha nga gusto ka nga mura kag ma-worry like you are now overthinking, no? Sometimes mag-overthink na nga grabe na kayo kalayo ang dagan sa utok nga maunsa mi ani. Ato lang sa siguro og tagaan ang ato ang gobyerno og chance like because kining ato ang panghitabo karon no wala man ni nato gipangayo so ato naman ning sulbaron so kung kita maglain-lain ta og destinasyon mura gani ginaingon nga if we are not in the same boat no sa usa ka boat nga padung og katong usa ka lugar pero lahi ang imuhang sagwan then di kita maabot sa lugar nga atong padulngan. So we are now the national government na nadiri sa ato sa syudad sa Sugbo. In fact, yesterday mga ka-quarantine, ilatang gibisita diri sa Vicente Soto Memorial Medical Center alang sa pagpahinabi kung kumusta ang atong hospital, kumusta ato ang mga numero. Okay? So Dr. Helen, kisa to naadiri gahapon?
Kagahapon naadid ni anhi diri si Secretary Duque.
Secretary Duque of Department of Health.
DOH.
Right.
Si Secretary Galvez sa IATF.
Okay.
O si Secretary Simatu. The DENR. Is now the chief implementer, right?
Diri sa syudad, sa Sugbo. Okay.
And of course, no, babatiin ko din, nandito yung aking kaibigan, no, si Dr. Ted Herbosa, and aking teacher na si Dr. Ofelia Saniel, and a lot of other people in the team. Daghan sila niyan hidire, no? They watched or they listened to the presentation sa atong Medical Center Chief, no, Dr. Gerardo M. Aquino Jr. Atong gi-present ang data and statistics that we have always been presenting even to the public from day to day.
Right. So ginaingon man gyud na always Dr. Helen ug mga ka-quarantine nga figures will never lie. Only liars cannot figure. So once you present the data, and that is really the happening around, in like example in the hospital, then we are really free to face you every day. Kaya makita man nga mao man ni ato mga numero, and then we decide based on the numbers that we have. However, please, if naatay wala na sabtan, like example, daghan kay sources karon sa internet, daghang sources sa social media, dili ta kasabot kay dili ta eksperto anang butanga or kanang lugara. Ang atong buhaton is mangutana. Dili ta mohimo og atong konklusyon kay dili man na nato area. And then that will result to overthinking, and that will also result to destroying a lot of relationships that you have. Because nga naman, example, ang imong messages puro na lang negative. Nya ni pangutana nimo ngano nakasulti man kani kabaw day ka, naday kay personal knowledge. Importante kay na sa pamalaod ang personal knowledge, meaning kahibaw jud ka, kakita jud ka. So kini sa mga butanga nga nega kayo, nega, di ba imo na i-unfollow? Unfollow. Or sometimes magdebate na.
And sometimes people even deactivate their Facebook accounts because of too much noise. Ang nasa atong Facebook accounts, no? Too much noise talaga. So we go back to our very first episode sa FB Live, no? Social responsible use of social media.
Right,
so you have to remember, ang social media is person to person.
Correct.
Whatever you publish, whatever you broadcast on your personal FB account or other social media accounts, somebody is bound to read it.
Right.
No? So you have to think, if you were the one reading your own post, how would this affect you? What is the impact of your own words on another person?
Right.
So if you don't want to be hearing these words from somebody else said to you, and then you don't say it to other people.
Correct. And subo kayo pa malandungon ba nga COVID-19 pandemic ta karon, no? Ang atong kontra dili makita COVID-19, okay? Pero murag sa social media, grabe naman ta ka nagkontra nga we are all humans, we belong to one humanity. And why are we fighting each other? And why are we giving an opinion when in fact wala pa rin kakabasa, wa pa ka kahibaw, wa pa ka nakakita unsa na, but imong opinion grabe na kaayo, mura makaana na ka, this is already hurting much our humanity, and this is hurting much all of us. So please, amo lang giawhag that in your use for social media, let's make social media as a weapon to destroy COVID-19. And don't use social media as a weapon to destroy us, to destroy people, to destroy your relationships. Don't use that because maggupot man, mura man ang social media na noon wagi COVID, mura na magmauna.
Remember, social media is simply a tool
Correct.
used by people.
Correct.
It can have good effects and it can also have bad effects.
Correct.
So please, if we all are really in the same boat, kinahanglan one direction ta, no, one direction
One
ra.
direction.
So our mindset should be to save Cebu, to really
Right.
save Cebu, and to unite, no, because
Unite.
di ba? United we stand,
Divided we fall.
Oo. So important that we are on the same boat, we communicate effectively, no? Sabi pa nila non-violent communication or compassionate communication.
Intelligent discourse.
Yes, and it's important that you put out there your need, no? Instead of putting other judgments, just simply lay down, this is what I need. Can you help me?
Correct.
So we have to be able to be aware of our limitations. We have to
Right.
be humble enough to be able to tell another person that this is what we need so we can work together. Even in
Right.
the workplace, lahat ng bagay pwedeng madaan sa mabuting usapan.
Correct. And I always believe, the power of obedience and discipline.
Yes.
When we are still in kindergarten or in elementary, if our teacher will tell us, that this is the rules, then we follow the rules.
Yes.
Very simple. Kay mahadlok ta, makasab-an ta sa itong maestra, mahadlok ta, nga mahagbong ta. Diba? That's simple obedience. And then, if we are going to go back to being to being children, diba? Jesus said, if you want to go to to heaven, be like a child. So, why don't we like a child that we obey? We give everybody a chance. We keep on blaming other people. We keep on blaming anyone. We keep on blaming other professions. We keep on blaming our government when we are in fact not doing anything in our chairs down there.
Yes.
The point here is simple. If you are frustrated, if you are anxious, if you are worried, okay? And if you are afraid, why don't we transform all of this into good action? Action means you can be understanding.
Yes.
You can be patient. Kung dili na ito mabuhat nga mutabang ta sa physical, pwede ta mutabang pagpasabot through having more patience and understanding. Diba? Dr. Brian Lim said, unsa to Dr. Helen, transform your frustrations, your anxieties, and your criticisms into actions.
Yes. So,
Okay?
And it has to be a multi-sectoral approach. Kaya
Correct.
dili raman mga frontline healthcare workers ang involved sa COVID-19 response.
Right.
So naapod ang ating police, ang
Police.
ating mga military, naapod ang mga politicians, yung mga LGU officials, ang mga at the level of the barangay, naapod ang atong mga social workers. O naapod ang ating mga non-government organizations, our partners, civil society organizations.
Right.
So I have been talking to some of the NGOs, no, and many of them really ask, no, mga private organizations, academe,
Right.
NGOs, are really asking, what can we do to help? No, because they don't want to just sit there and just watch everything unfold and
Correct.
everything gets messed up. So it's important that all of these sectors, all of these groups are given a voice to say their concerns. na ay mga child caring organization. So, now with the removal of the quarantine passes, the problem is how will they get their basic or their essential needs?
Right.
Kinahanglan pa kanon ng mga children or mga tao sa balay. So na ay daghan nga mga problems, no, or mga worries sa mga tao nga naa sa community.
Yeah.
So I think we really need to be able to address this. So kung nag-watch party mo karon, so you can actually post on the comment section unsay inyong mga kabalaka
aning atong sitwasyon karon.
Yung mga concerns nyo, you post it there, so we will collate it and we will give it to the IATF or whoever is in charge of the COVID response in Cebu. So it's not just health. It's really not just health. And it's also economics, employment, food security, transportation, access to healthcare.
Yes.
Because I've heard of a lot of people na sa balay, na gibati, pero dili mo anhi sa ospital kay nahadlok na matakdan og COVID. So nag-anto sila pag anhi diri sa ospital kay dili nakaginhawa, wala na.
Right.
On arrival.
Right.
So really nothing that we can do. This should not be happening at this moment in time.
Correct.
This is reason why kung COVID positive ka na kay gibati, no, you have to get tested. In Cebu City na atay mga cluster clinics. So you have to know the 5 cluster clinics where your barangay belongs. Kay open naman sila from 8 a.m. to 5 p.m. from Monday to Saturday, and they are doing swabbing there.
Correct.
So kinahanglan informed ang tanan nga mga communities na naa mo'y cluster clinics na ay doktor diha. So you can go there and consult. Aron kay baka kung grabe na di ay ang imong condition, ang imong gibati, or okay pa na mag-remedy ra sa balay or mag-observe or mag-monitor. Kay kung grabe na di ay, that's the time that you will be referred to higher levels of care like the hospitals.
Correct.
So in every intervention, naatay gitawag nga risks ug benefits. Ang
always.
risgo ug ang benefits. So tanan, whether you have a medication, you have an intervention, you have anything, no?
Right.
Like surgery, for example, a surgical intervention will have its risks and its benefits.
Yes.
And for every person, you have to weigh the risks and the benefits.
Correct.
If the benefits outweigh the risk, then kana go forward with your intervention. But if you look at the intervention and the risks of the intervention outweigh the benefits, then maybe this intervention will be more harmful than good.
Correct.
So that is the
Agree.
way we look at everything during this COVID-19 response. There's no one cure-all. So it's important na we evaluate for each person, no, not for everybody, no, hindi siya one size fits all. So case to case basis.
Yeah, it's not pure mathematics like you 1 plus 1 equals 2.
Yes,
okay? So it's not always like that.
And one of the things nagiingon sa atong visitor sa IATF, importante ma-improve ang public information dissemination.
Alright.
So one of the most important things, no, na kinahanglan kay bawo kamo mga ka-quarantine unsa man ang sintomas or mga gibati sa mga tawo nga naay COVID-19. Sige, attorney.
Pwede kanang karatutunlan, ubo,
kana.
sipon. Pinaliman niya ako ha. So, kung nakakara tutunlan, ubo, sipon, ayaw ka panik. Ayaw lang sa'yo ka panik because you can always observe. Pwede pa man imong obserbaran imong kaugalingon. Pero dili sa tamo baka, no?
Yes,
dili tamo baka, obserbaran atong kaugalingon, and then if symptoms persist,
consult your doctor.
Alright.
Kasi baka mamaya the night before sige kag karaoke. Hello.
Yeah, basin ka na. Di ba?
The next day wala na kay boses, wala na kay anong boses?
Tingog.
Wala na kay tingog. Ingon ka na, sore throat na di ay hala, COVID na di ay. Dili pa di ay.
Dapat atog yung tan-awon og klaro. So balikon yung tana nga. Basa ta. Sabton sa gyud.
Yes, and the number 1 is the fever, no? Kaya everybody has a thermal scan, checking the temperature of everybody coming into any building. So kung na ay fever, cough, colds, sore throat, or body malaise, sakit ang mga
lawas.
If there's loss of smell, dili ka Smell.
Katimaho o loss of
Smell.
katimaho.
Okay,
O
or loss of taste.
also
Dili ka
panglasa.
panlasa sa imong mga pagkaon.
Okay.
Yan.
Okay, so kana ha timan-an na siya. So here palihog ta kung naamoy mga concerns sa panghitabo karon sa atong palibot, no? You can always send it to here sa atong comment section. Pwede mo diri mo send para atong
24/7.
matubag og naapod tay lain pod sa inbox, no? Inyo nang makita later para matubag yun nato ang inyong mga concern. Sama ni Bahi Dabasol, no? Salamat sa pagtan-aw. Maayong gabi Doc Helen, Doc and attorney. Maayo na adjud sila diha. Abi na mo Sunstar ra sila naminaw. Di kaayo ta mabalaka, amping mo diha. Wow, thank you so much. Og naay question si ako ni scrap buyer. Is it true private hospitals ang naay problema sa medical workers? I think we have to to really determine the context here. Unsa nga giterm nga problema? Because we cannot mao ni atong gipasabot, no? Sa imong pagbasa like this, mo basa ta naay problema sa medical workers. Let's evaluate unsa man ni nga gitawag nga problema sa medical workers kay sa atong nahibaw-an tanan man gyud nga hospital na gyud mga concerns sa atong mga medical workers. It can be a concern kay na-quarantine, it can be a concern kay naay positive case, it can be a concern kay nahadlok na mo trabaho, it can be a concern nga di kasud sa trabaho. For example, transportation. Nabasahan man sa uban Doc Helen nga dili na daw kuno pwede musud sa Cebu City ang taga-province. So gi-generalize dayon ang thinking sa nag-overthink dayon. Wala na mi di na mi katrabaho. Then we relate how do you call this? We go to the proper office, the proper forum, and we discuss what is the reality on this. And we were given a scenario that we still adopt the given executive order. So, dili kita dapat mag-overthink, maubitaw na ay mga balaod para atong subayon o atong makita unsa gyud ang sakto nga buhaton kaysa mag-overthink or mohatag ang opinion nga dili sad siya mao, no? Kay wala may basis. Okay? So this one, if this is the issue of healthcare workers, there's so many factors to check on that. Okay? And we don't want to call it problem. It's better to call it challenges or concerns. Okay?
And also, if you are a healthcare worker, importante na magsabi, no? You let your administration know what are your concerns so that they are there, they're ready to help you and facilitate whatever it is that you need.
Example, healthcare worker nga naa kay problema sa imong hospital. Okay, example ha nga scenario. Ato ning kuan ang pangani sir, no? Ang kiniyahang punto, no? Itanaw in proper context. Ikaw, healthcare worker, nagtrabaho sa hospital, na kay concerns sa imong schedule, sa imong kahadlok and everything.
Okay.
Asa makadapita mo adto? Sa imong social media or sa imuhang management? Ang sakto nga buhaton ug makatabang nimo is you are going to raise your concern to your management first.
Your direct supervisor.
Your direct supervisor. Kung dili pa igo sa direct supervisor, adto na ka sa next nimo nga supervisor. Or next yung hantod mabot sa kasinatasan. Di ba? That is responsible citizen. That is a responsible person. Mao ni kita ingon nato nga we go back to elementary rule. Go back to our values. Kay we keep on saying here in Soto Live that COVID-19 is the real and the ultimate test of character. Diri nimo makita mga ka-quarantine unsa ang mga tao sa imong palibot, kinsay kaya mo padayon sa pasensya, kaya sa pagsabot o kaya nga mangita paglaing intervention. Dili nimo makita kinsay tinuod nga positive. Di ba? Kisa po yung mga super negative. Di ba? Dili man nimo makita sa COVID-19. O ingon si Miss Van Lacno, based on facts para dili mapraning. Correct. Mura nig abogado ni si Mamo based on facts.
Oo, sa pag-manage po nato sa mga pasyente, importante ang research, importante ang pagtuon, no?
Okay.
So all healthcare workers have the mandate or the requirement to study the interventions na imong ihatag.
Correct.
So it has to be evidence-based because expert opinion is the lowest form of level of evidence. And if you are critically appraising your research, because medicine really is a lifelong learning. Dili just because you mag-graduate na ka, dili na ka magtuon. So
Correct.
every day kinahanglan magtuon. And again, no, walay maayong lalaki or
May laki.
babae.
May laing babae.
Sa COVID-19 kay bago man ning COVID-19, wala pa ni sa textbook, no? So tanan nga mga information naa pa sa mga research articles. So, importante, mag-critical appraisal of topics of COVID-19 research evidence kita.
Right. And when we want to point our stand and our views on matters of COVID-19, we can always give it with intelligent discourse and with finesse. Dili ta kinahanglan mo state pa you like crossing the line or inappropriate statements on things. So, dapat, mga ka-quarantine, always remember that what you post, what you do in social media reflects the owner of it. Yes. So, it's better to go back to responsible social media use.
And
okay?
be professional, both online and offline.
Correct. Okay, so kana mga pahimangno, mga points of view, nga among gipa kamo mga ka-quarantine, you are part of this family in Vicente Soto. We always want to ensure that kamo diha sad is tagaan mo na mo sa saktong impormasyon ug karong gabi una mingon ni Dr. Helen, do not overthink of the situations around you. Always remember this, the difference between control and manage. Di ba? Ang mga butang sa palibot nato, kung naunsa may nahitabo karon, bisag maghilak pa kag dugo, dili na nimo makontrol. These are the things happening around us. But you can always manage the way you think, the way you feel, and the way you act on all of these circumstances around you. Imo nang gahom. Power na nimo diha mga quarantine. Walay makakawat ana nimo. The way you manage your thinking, your action, and your feeling, it's all up to you. That's how you do manage. But di na to makontrol ang panghitabo. Di ba?
Yeah, so
these are all happening already. So let's give everybody a chance to step up. Let's give everybody a chance that we will solve this COVID-19 in due time. Nasulbad na lagi ni. Salig lang yun ta. Dili lang ta ka ng, dili lagi ni masulbad. O kung dili ni masulbad, ganun buhi pa man ka. Di ba? Ganun na pa man ta. Di ba?
There's something funny about mga FB, mga Facebook memories, no?
Facebook memories. You have that.
Okay, murag the universe is really speaking to you. Mga post nimo
history.
sa una. Post nimo sa una,
FB
babalik
history.
Nimo, no? So that's why trash, ang basurang tinapon mo ngayon, babalik din sa'yo. So if you're on Facebook, do not put out trash, no? Make sure that the information that you post on Facebook will be for somebody else's benefit. Kaya mabalik man na nimo. Some of the posts that I had before,
pila na ka years?
This was in 2013.
2013. 7 years ago.
7 years ago.
So what's the history?
No one can drive you crazy unless you give them the keys.
Wow!
Okay.
No one can drive you crazy unless you give them the keys. Atong binisayon.
Sige.
No one will drive you crazy. Walay praning, walay makapalibog, makabuang, makapraning nimo. Kung dili nimo ihatag ang imong yawi. No one can drive you crazy if you're not going to give your key.
Yes.
So don't give your key, mga ka-quarantine.
So
okay?
nakakausap pa on 2012.
2012.
Good things come to those who wait, but better things come to those who work for it.
Wow.
Mayo.
Okay.
So it's important, especially during this time of COVID-19, at kitang tanan, no, magtrabaho ta, kay it's important na each of us, no, dili man trabaho na job, no, kinahanglan na atay mabuhat aron makakontribute ta sa effort sa COVID-19, aron dili matakdan ng mga tao sa COVID-19. Prevention is better than cure. The first line of defense is in the communities.
Correct.
So for those of you who are at risk, please lang stay home. This is the real reason why naa na mga military kay dili ta gusto nga magpakalat-kalat, no? pakalat-kalat.
Magpatakala gawas-gawas.
Ang mga tao nga at risk for COVID-19. Okay?
This is not the time for denial nga maingon ta nga way nagawas-gawas. Kaysa tinuoray, bisag kamo diya maka-quarantine, mag-drive mo, di ba? Inyo yung makita nagi mga tao, di ba? Sa naidaghang tao nga nang gawas na gyud.
So kung sacrifice lang ngayon, sacrifice ta karon kay kinahanglan man aron dili na mo daghan ang naay COVID-19.
Correct.
Because long term matatapos din naman to. So,
mahuman na lagi ni.
Yes,
Agree. Mahuman na gyud ni. Mahuman ra.
So since ngayong gabi, we are talking about practical health tips. Hindi kami mapapagod na paulit-ulitin tanan nga mga practical health tips aron atong malikayan ang infection sa COVID-19. So atong sundon ang pahimagno sa Department of Health.
Alright, tanaw na to ang video, very short video from the Department of Health, mga ka-quarantine.
Yes.
Sa pagpakigbatok sa COVID-19 sa atong nasod, importante ang kooperasyon sa matag usa. Ang pagpuyo sulod sa atong balay maoy usa sa pinakasimple apan pinaka-epektibong pamaagi aron dili makakalat ang virus. Pananglit, ikaw kining tuldok, himsog og baskog. Nigawas sa balay, ang wala nimo mahibaw-i, may nakahimamat kag tawo nga naay COVID-19. Timan-i, lisod mailhan kung kinsa ang dunay virus. Apan dali kaayo kining mapasa sa uban, mahimong napasa na di ay niya ang virus nga anha nimo. Sa dihang miubos siya o mihatsing o posibleng natakdan na kay nakagunit sa parehong mga butang nga kontaminado. Karon, aduna kanay COVID-19. Giisip ka na nga carrier nga makapanakod sa uban. Kay basin mulutaw paglabay pa sa pipila ka adlaw ang sintomas sama sa ubo, sipon, paglisod o ginhawa ug hilanan. Mahimo pud nga wala kay gibating sintomas. Apan makapanakod gihapon ka pag uli nimo sa balay, mahimong makapanakod ka sa imong pamilya. Apil na ang imong lolo ug lola o mga ginikanan nimo nga may edad na. Sila ang adunay pinakahinay nga depensa batok sa virus. Ang adunay sakit sa kasing-kasing, diabetes, high blood ug uban pang pre-existing conditions ug ang mga mabdos. Hinay ug ang pagbatok sa COVID-19. Kung naakdan ang tao nga hinay og immune system, mahimong makaangkon siya og seryoso nga sakit ug kinahanglan nga dad-on sa ospital. Sa padayong pagawas sa panimalay ug sa pag-adto sa mga pampublikong lugar, mahimo kang makatakod og tulo pa ka tawo ug sila makapanakod og mas daghan pa. 20% sa natakdan mahimong maospital, managhan ug managhan kini samtang mikatag pa ang virus. Sa nakadaghang pasyente sa COVID-19, may daghan pang dunay sakit nga anaa sa mga tambalanan. Ang mga pasyente nga naglisod ang kahimtang, dili na maatiman. Wala nay lugar alang sa mga pasyenteng adunay laing gihambing balatian. Kaya natong likayan ang padayong pagkuyanap sa COVID-19. Kung naghuna-huna kita sa kaayuhan sa uban, kinahanglan natong maghuna-huna og muaksyon nga murag bit-bit na nato ang virus aron dili na kini mukalat pa sa uban. Sunda ang social distancing ug kung mahimo magpuyo kita sulod sa atong balay. Kung kinahanglan gyud nga mugawas, pirmiha ang 1 ka metro nga gilayon sa ubang tawo. Kinahanglang limpyo ang atong lawas ug ang palibot. Pirming manghugas sa kamot gamit ang sabon ug tubig ug i-disinfect ang mga butang nga pirming gigunitan. Ang importante, atong mapahinayan ang pagkuyanap sa COVID-19. Aron mo gamay ang kinahanglang magpa-ospital ug makuhaan ang mga Pilipinong nagkasakit. Mahimong epektibo lamang kini kung magpermanente kita sa atong balay. Sundon ang social distancing. Usa ka gamay sakripisyo alang sa kinabuhi sa sama natong mga Pilipino. Magtinabangay kita. Atong sugpuon ang COVID-19.
So let's beat COVID-19.
Atong sugpuon ang COVID-19. Dili nato sugpuon ang usag-usa, kundi ang COVID-19. So that video simple ra to siya kahibaw ta atong utok may kabaw na miya na okay kahibaw lagi ta, but do we practice it? So it's very important that those things must be shown and must be done by our family members, our friends, and our colleagues. So because mao ra magini makatabang natong tanan, right, Doctor?
And remember na ay mental health impact ang COVID-19. So these are not normal times, no, abnormal times ni. So kini na ang atong new normal. So kinahanglan kay bawta mo adjust, kay bawta mo adapt, no, and kay bawta mag-cope sa mga mental stresses. That's why every week natay usa ka adlaw to talk about mental health.
Yeah, Tuesdays.
Yeah, so and Thursday na to, di ba? Shout out for all frontline health workers.
Right.
So kung kamo diha naka-appreciate mo sa tanan nga mga healthcare workers nga nagserbisyo ninyo, please do post, no, bring out your messages, pictures, no, video, TikTok dance, no. I think it really helps those who are there in the hospitals, in their work areas, away from their families. Kay daghan man sila'y kabalaka o kahadlok, no? So, but these positive things or positive messages, if you keep on putting out all of these positive messages, and then it will drown out all the noise from the negativity. Correct. Sabi pa ni Catriona Gray, negativity will not foster. And there will always be a smile on the children's
silver lining. Oh, diba? Negativity will never foster.
And remember, we were talking about kindergarten.
Yeah, kindergarten.
That is where you learn the magic words. Ano yung mga magic words?
Thank you.
How
are you?
Si Magia. No, what's the magic word? Thank you.
Thank you.
And then when you want something, please.
Please.
No, okay. And then when you give something, you can say, you're welcome.
You're welcome.
And
please.
pag nagkamali tayo,
I'm sorry.
You know how to say, I'm sorry.
Correct. So these are basic, the children know better.
They teach us
diba?
How
ang mga bata mao'y nagtudlo nato nga unsa gyud ay ang sakto nga mga pamatasan. Kay dili man nato mabuhat di ay kay karon demand blame, pangaway, sobra di ba nata sa mental health katong sa fever katong tungod sa cabin fever. Please take note mga quarantine. Sa imong kalagot, lagot kay ka sa panghitabo, worried kay ka, init kay mong ulo. Nya makaingon ni kala hilantan ko. Kana nanginit lagi ko diri doktor. Hala, gi-COVID na ko. It will add more worries, di ba? We call it in mental health cabin fever.
And actually, it's social media that can connect you with the outside world. If you look in 1918 when we had the Spanish influenza pandemic, no? Sa una, you really stay inside your home with nobody to talk to. Kay wala man sila yung mode of communication. Wala pa'y cellphone, wala pa'y telepono, wala pa'y social media. But now, we have social media as a tool. We have to use it for the good. So, to connect yourself with the outside world. But if you're only going to listen to noise and negativity and ranting and all of these things that you
all the rants in the world.
Yeah, so you better turn off. You better disconnect. And ano sabi nila? Detoxification.
Digital detoxification will help. Digital detoxification is forget about it. Do not have much of your time in social media. Yes, social media is very good. Pwede makamurant. You can rant. Adto na lang mo sa inyong GC group chats, okay? But don't rant like you are putting it in your wall and then people are also ranting like you and then everything will be ranting and then both of you, the three of you, the four of you, the five of you are not solving anything.
Yes.
Okay, you're just adding the burden. Okay? So, freedom of speech, as we always emphasize here in Vicente Soto, yes, it's okay. We have freedom of speech, expression, and all the rest of the freedoms related to that. However, we have to always remember when to use it properly. And that is responsible citizenship. Okay?
Sabi dito ni Vilma Lavisores, good evening, Attorney RC and Dr. Helen. Very well said, Attorney RC. Think positive but not COVID positive. Always look on the brighter side of life. Remember that there is always a rainbow after the there's a rainbow
after the rain.
So the only thing we need to do is cooperate and self-discipline is a must. Keep safe, everyone.
Right, alright. No, because na-hurt, no? Daghang na-hurt. Ingon sila, na-hurt sila, kay giinan ko no ang Cebu o gahig ulo. Nya, nag-rank dayon ka, nagyaw-yaw din ka. Are you not also showing that gahi gyuday ka og ulo sa imuhang gibuhat? So, if you believe that it is not true, then let us prove to the national government that dili tagahig ulo. Simple. Mora gani siya gipangita. So, ingon si Ma'am Vilma, we have to cooperate and always provide self-discipline. Ingon po ang uban, kami nag-self-discipline man mi, nagkuan man mi, ngano kapila-pilon man mi ninyo? O sige, unsa din ni diri di ay kanang piliay lang gay ni nga COVID-19 this is all of us being affected. So tinabangay, please, tinabangay. Okay? So, Dr. Helen, do you have...
napay usa. Wait lang ha. Because it's also important that you don't treat others don't treat people as bad as they are.
Yeah.
Treat them as good as you are.
As
so
good
even
as you
if
are.
people are doing all of these things, it doesn't mean that you have to do it also.
Yeah.
So you have to lead the way. You have to show them how it should be done. That communication can be non-violent. Communication can be compassionate.
In our noble and humble attempt for public information and
Yes.
communication and education, we are not perfect people. Vicente Soto is not also a perfect organization,
Yes, it's far from ideal.
It's far from ideal. But this is the mandate that we have to share to you through public information, education, and information. Wala mi mabuhat kung dili nato na siya makita sa sakto nga perspektibo. Kay nabi tay istorya, Dr. Helen, katong istorya sa turtle o sa scorpion.
Okay, sige.
Okay. Ang turtle o ang scorpion, no, pareha sa COVID-19. Gusto mo labang sa Picas side of the river. Kaya gusto naman ta, pareha na to karon, gusto naman ta, mawa na ng COVID.
Makalabang sa ECQ.
O makalabang sa ECQ. So, ang turtle, ingon ang scorpion sa turtle nga, hey, turtle, can I ride at your back?
Okay.
Ingon si scorpion,
Pasakya
ingon din si
ko.
turtle, pasakya ko. Ingon sa din si turtle, di ko, uy, imo kong paakon, mamatay ko. Ingon si scorpion, pasakya lagi ko, turtle, kay magkuyog ta padung sa Picas nga isla, kay mulabang sila. Just like karon nga COVID, di ba? Gusto ta mulabang GCQ to ECQ, ECQ to GCQ. Ingon si turtle, di lagi ko, mamaak lagi ka, mamatay ta. Isa, promise turtle, dili tika paakon. Og tuod man, nisakay ang scorpion sa turtle. Sa Bisaya sa turtle, bao. Bao ba? Bao, sakto ba ko? Okay, nisakay ang scorpion sa bao. So nilarga na sila in the middle silang journey. Happy kayo sila, storya about life, about everything. Pag middle na ron Dr. Helen sa river, o sige buhat ni scorpion.
Gipaak.
Iyang gipaak ang bao.
Okay.
Ang liog sa tambok nga bao.
Okay.
Iyang gipaak. O napuison si bao. Nalunod sila.
Okay.
In the middle of the river. Nihilak si turtle. Ingon si turtle, you told me, di ba, nga di ko nimo paakon. Nganong imo man kong gipaak? Karon kita nang duha ang mamatay. Ang tubag ni Scorpion, sorry kaayo. It's my nature.
Yes,
So kami mga ka-quarantine, diri sa Vicente Soto, bisag unsa pa ang buhaton ni bisag kinsa sa inyong kinabuhi. Pero kung that is really the nature of being negative, wag ito'y mabuhat na.
Yes.
And it might lead to our defeat. Okay? Wag ito'y mabuhat because it's a nature.
Yes.
Diba?
Well, it's the nature of the scorpion to bite, but then it's the nature of the turtle to help.
Correct.
The same way, be it your nature to help, regardless of whether other people may bite or hurt you.
Alright. Thank you so much for that, Dr. Helen. No? Grabe
And,
nga, moral of the story.
Okay.
And Dionaldo, hello sir. VSMMC and all the frontliners keep safe and keep being negative from COVID in town. Sure, sir.
Okay.
Praying for all of you. God bless you all. Salute and thank you for all your hard work.
Yes.
Wow, daghan kayong salamat.
Sige. So, and we want to grab this opportunity to thank our medical center chief, the producer of the Soto Live, and the incident commander, Dr. Gerardo M. Aquino Jr.
Right.
For always being supportive, for always thinking out of the box.
Always out of the box.
Unique interventions for
Ingon
the
gina siya always,
abnormal
diba?
conditions.
In every abnormal conditions or abnormal circumstances, you need also an abnormal solution.
Yes.
Stay out of your box. O,
Yes.
di ba? Mo na Dr. Gerardo M. Aquino Jr.
Okay. And we want to thank also the IATF and
IATF.
thank you for the national government for stepping in and helping us because it's important that we get past the ECQ to
Right.
the GCQ.
Thank you so much, no, Secretary Duque of DOH, Secretary Simato of DNR, and Secretary Galvez of the Chief Implementer, right?
Yes, and we like to thank them for all of the help that they have extended to not just to Vicente Soto but to the whole of Cebu.
Correct.
Thank you very much.
Thank you so much.
Okay, and we also like to thank the OPAV under Secretary Mike Dino. And also our DOH 7 Regional Director, Dr. Jaime Bernadas and his team.
Yeah, thank you, Dr. Bernadas and the team.
Yes, and we want to thank the LGU hospitals, no, because all of these hospitals, including the provincial hospitals, we belong to one community of healthcare workers. I just want to shout out, no, hindi lang po Soto ang ospital sa Cebu. So, in the provincial hospitals, you have one CPH Bongo to the north, you have CPH Balagban, you have CPH Danao, and CPH Karkar to the south. Okay, so mga taga-probinsya, these are your Cebu provincial hospitals.
Right.
In the city hospitals na ay usa sa Lapu-Lapu, na ang Mandaue, na ang Cebu,
na Toledo.
At ang Talisay.
Talisay also.
Toledo is provincial.
Provincial.
Oo. And we have the DOH mandated hospitals. You have Eversty Child Sanitarium. You have St. Anthony Mother and Child Hospital and Talisay District Hospital, which is now South Cebu
Medical Center. Cebu South Medical Center. Sesmed. Oh,
okay,
diba?
yeah, Cebu
wow,
South
congratulations sa atong mga
Medical
kaubanan
Center,
diha sa Talisay District Hospital nga karon gitawag na og Cebu South Medical Center. Wow, congratulations to the team of Dr. Agos in Talisay.
Yes,
Okay?
so these are the hospitals that are ready to serve 24/7.
Alright, kung kami sa diri sa Soto ready to serve sa DNI, kung wala mo'y makita nga tao na atay social media platforms.
Yes.
Oh, nariya sa scroll.
Kana.
We have Facebook and Twitter.
At official VSMMC.
O kung gusto mo mutanaw sa mga clearer videos, adto ta sa YouTube, subscribe to our YouTube channel at
Vicente Soto
Memorial Medical Center. O kung gusto dyan mo send og emails, shoutouts o mga reklamo, suwisyon, adto ta sa
email
vsmmc_osm@yahoo.com. So mao to, daghan kay tang mga pwede maistoryaan, mga quarantine ug ugma nami ma-launch sa inyuha nga usa ka social media research. Ug ato ni siyang
kay naatay mga perception survey kasi we want to know what you're thinking. Okay, we want to know what your concerns are. So the question will be, what are your most driving concerns during these times of COVID-19 crisis in Cebu, so that when we collect all the data, we can give it to those in charge so that we can find solutions. Because if you're not part of the solution, then you must be part of the problem.
Okay.
It's better to be
part of the solution. Okay, do not problem the problem. The problem will problem you.
Yes, because in Cebu, no, we have a lot of volunteers and a lot of generous donors. And
thank you so much.
We are part of really one Cebu community.
Mabitaw mo tan-aw ta Doc Helen, no, sa reality sa palibot sa ato sa mga social media. Makaana gyud ta ba nga Cebu City is still a very good city.
Yes.
It's still very beautiful with people nga grabe ka helpful, grabe ka, you know, the sponsorship, the donations are coming for our patients. Yeah, everyone is like reaching out.
Yes.
So this is really a place to be. It's still the Queen City of the South.
Yes.
Indeed. Okay? Og naay diri pahabol si Ryan Bibual. Great insight. Thank you for sharing, Attorney and Dr. Helen. Wow. Thank you so much.
Thank you very much.
Si Joanne Anoba, stay alive, frontliners. Praying for you always. Sa tanan nga mga nagtan-aw nato karong hapuna ni ani atong Soto Live, daghan kayong salamat, and we hope nga we have shared to you our sentiments and our concerns and our insights. Ug kabaw kayo mi nga kamo po diha nga nagtan-aw, makaingon sa mo bitaw. check. Because you also think that way. Nga,
Yes.
sakto pod da og mga panghuna-huna sa karon sa panahon sa COVID-19. We don't want to be overthinking with things that will destroy our focus and our peace of mind. Okay?
So we continue with our Vicente Soto Memorial Medical Center FB Live. No, this is to bring to you transparency and accountability because we are public servants and we are always willing to serve.
Right. Kay dinhi sa Soto, kalidad nga serbisyo among garbo. Kini si Attorney Panugali.
Kini si Dr. Helen Madamba.
Mao kini ang Soto Live. Maayong gabi!